Ever notice someone dragging large black bags through the hospital lobby and wonder who they are? That, my friend, is a medical device rep. Welcome to Device Guys. Your hosts, Brent Lloyd and Jason Doliak, bring 50 years of combined medical sales experience to the table, sharing insights, stories, and a behind-the-scenes look at this fascinating world. Enjoy the conversations.
Let's talk a little bit about like the early days and then and industry's role. I mean, this show's about device, and what's industry's role, and how did you view us in commercializing this product, and how did you what value did you put on us? How did you rely on us? Like how did you see the role of industry in the launch of the therapy?
I think it was interesting here in that Edwards was a surgical heart valve company who now was bringing in a product to compete with their bread and butter product. And so that put them into a uniquely powerful position of building these teams that I mentioned, of trying to do the right things for patients and bringing in all of the rigor and expertise of the surgeons that they knew so well. And you know, this is where Larry Wood and Edwards, the whole team and the surgeons who were involved, and this is Craig Smith and Michael Mack, who are the real leaders working with Marty Leon in the early partner trial, who had this vision saying, we're going to put patients first and figure out how to do the right thing, and bringing together teams of surgeons and cardiologists under the leadership of Edwards. And Edwards brought together this tremendous rigor of creating a surgical-like standard to make sure that outcomes were good and putting patients first. And I give Edwards a ton of credit in how they built that program. And I think I'm not alone with that. This is, I'm just copying what everyone else is saying, and how the whole field owes Edwards a certain debt for building this type of camaraderie and patient-first attitude.
Right. This is the first time that ever happened, where you guys were in the room together.
Absolutely. And it's something that's carried on until today. And the surgeons who I work with are my good friends and colleagues, and we don't look at each other as rivals or competitors anymore. We are partners in every way. It's awesome.
The team approach that has come about from this therapy, I think, is really important for patients. And that to me seems like, you're getting the collaborative approach of many specialties to get the best outcome. And that does seem like a great path forward for medicine in general.
Not only is it great for patients, which is most important, and it is, but it's also just a great place to work, right? Mm-hmm. If we go to work and we enjoy the people we work with, how much more rewarding is that than if we are competing with each other? And
right.
That's part of why I love my job, is I really enjoy working with my colleagues there.
That's a good lead into this. Like, I talked about going down this path with you when you came in, but here on the Wasatch Front in Utah in general, it's such a collegial atmosphere, right? There's the university, there's St. Mark's Hospital, there's a couple of other Intermountain hospitals, but it doesn't seem so competitive. It seems more like everybody's trying to do the right thing for the patient. I remember I got you to a dinner at one of the TCTs with Fred Welt from the University of Utah, and I think Eric from McKetty and Vomsey from St. Mark's was there. And there's not this competition. There's not this competitive attitude. It's more collegial here. And I think the Wasatch Front owes a lot of that to you, the way you kind of launched TAVR at your site and the way you kind of helped people. You were proctoring sites that you would consider competitive to your hospital, all in the interest of growing the therapy and getting it to patients in a way that it was safe and they had access to the therapy, which I think is awesome.
Well, you're generous to give me credit. I'm not sure if that's fair, but I'm fortunate to work with really great colleagues in this city, and I very much enjoy working with them. And Anwar also,
Dr. Tandar, yes,
Dr. Tandar, and Vomsey, we want our patients to receive great care wherever they go, right? And I think everyone in this city recognizes that, and they refer patients to me. I refer patients to them, and it's nice that we have a patient-first attitude. That's awesome.
Yeah, that's cool.
Do you guys take the approach of finding the guy that's best for the job at hand? Finding the guy that has the most skill, or feel like you can have the best outcome?
I think that's a fundamental important rule of medicine, right? Is that we always try and put patients first. And I never want to do a procedure if someone else can do it better than me. Bob Gray, for example, at Primary, is a lot better at doing pulmonic valve replacement than I am, and it was quick and easy for me to involve Bob and refer the pulmonics to him because he does a better job, and I would never want a patient to
Right.
feel like they were coming to a second physician who wasn't as good.
Right.
And last week he came over and helped me do a procedure. I called him on the phone for advice. He said, "Are you doing that now?" I said, "I'll be right there." And I hopped in an Uber and came over.
He was in an Uber. He rode his bike to work that day.
Right,
Told
he
me. Yeah.
popped in an Uber and came over and helped me do it. And how is that for collaboration,
So cool.
right?
That's
Is
a
that the
great
best
community.
ever, right? Amazing.